Today we got Anna West, who is the founder of Sleep to Perform, and she's a sleep expert and works a lot with football. Welcome, Anna.
Thank you very much.
Sleep is a wide topic, and it's probably interpreted in different ways depending on who you talk to. But today we're going to focus a little bit about sleep and football. And can you tell us a little bit about your background and how you get into the area of sleep and also later on football? Because right now it's a hot topic, a hot area.
I can for sure. My way in has not been straightforward. So I have a background, I'm a nurse and I studied sports science as well. And then I was very fortunate from the beginning of my career to actually work in a sleep technical company that developed sleep diagnostic equipment and things for sleep disorder treatment, and built up in that company back then our whole sports science arena. And that was 10 years ago, where sleep was this niche thing that was often worked with in the treatment segment, but not in the prevention segment, and very, very little among athletes, to be fair. And then slowly started to build more and more research projects, practical projects all around Europe. And then back in 2016, I decided to start my own company, purely focusing on the consultancy side of things. And I'm working primarily in football, but I'm also working in other sports as well.
And what do you think, what is the reason, we spoke a little bit before this podcast, that the rise of this area in all sports and in general, but you see and you read about it in football a lot the last 3 or 4 years. What's your take on that? Why has that become such a hot area?
I think, to be fair, everybody knows that sleep is important, and we knew that 10 years ago as well. But I think the significance in detail on how we can correlate it back to performance outcome as well has been increasingly proven. So we're not just talking about sleep being a factor in performance optimization. We're talking about sleep being the cause of a decrease in certain performance parameters as well. So we know that there's a quite strong link, as an example, between sleep, poor sleep, and the increase of injuries. If you take Premier League as an example this year, where you saw a very strange ending to last season, and then Project Restart, where we reduced the preseason time, and you've had congested scheduling, a lot more games. And I think it was back in November, Premier Injuries, they published a statistic showing that they had a 42% increase in muscle injuries in the Premier League, which is the highest that has ever been seen. I think the interesting debate has been that statistic have predominantly been alluded to the fact that you had congested scheduling, but not the fact that athletes, or players for that matter, they have very, very, very little time to recover and sleep in. So I think that because there's a very strong link between us seeing players suddenly not be available because they get injuries and so forth, it's now an argument, not only from a performance side, but also because it's expensive to have players that are not able to play, right?
Yeah, and for sleep and breathing is, to some degree, everybody knows that, like you said, sleep is important, and most people know that breathing is important, but it's invisible to some degree. So it's a matter of, I would say, of degree, that they think that, okay, sleep 8 hours a night and have a cool room or whatever, but it's a very deep and complex area. So how have you dealt with that to make some of the things visible, so to speak?
To be fair, I think sleep maybe has a slight advantage as opposed to breathing when it comes to that, because having sleeping disorders in terms of not being able to fall asleep, in terms of having a low sleep quality, low sleep output, it will become visible over time, but measured on a series of parameters, right? So yep. You'll be more prone to the negative mental side. You'll act out on core. Your decision making will be affected negatively. Your reaction time can be spotted as decreasing and so forth. So there are some quite clear measurements or negative outputs on poor sleep. just ask people, or look at the bags under their eyes over a certain period of time. So the visibility of not sleeping well will at some point be seen, to be fair.
Yeah. So if that's built up, like you said, that you have sleep insomnia or whatever you have, how long, because somebody may have had problems for 6 months, somebody for 6 years, but how long would you expect somebody to see improvement after you work on it? Are we talking 2 days, 2 months, 2 years? What is
it's a very good question, because what I sense quite often when I work with the elite football environments is that they want to have the quick fix, right? They want to see a very quick result when someone like me is allowed into the environment, if that makes sense. And the thing is, with sleep, just as we could argue with breathing techniques, it needs investment, but it also needs continuity in order to actually create results. And one of the big impactors when it comes to sleep is to create the consistency in whatever method that you're using in order to turn around the negative sleep cycle. And then again, taking that into a football environment is actually a little bit of a challenge, right? Because we know research would say one, but the commercial side would say something else, because we would have late kickoff times in football. We all know that late kickoff times would mean that the athletes or the players would play late at night and so forth. So in order to see results, I would need to look a little bit into the sport, and I would look a little bit into the profile that I'm working with. But what I do in my methodology is that I don't work with players unless I get to work with them for at least 4 months. And when I tell that, usually people are a little bit strong, like, but can't you see results? And I'm like, yeah, you'll start to see results, but my aim is to create sustainable results. So I know that the things that we will embed into the rhythm and the methodology that we're using is not something that they need to think too much about. It's automized and it's sitting on their spine, and they keep on rehearsing it.
And Anna, I'm intrigued, because in terms of, say, a negative sleep cycle, what is that? And the other aspect is, do the players track their sleep using Oura rings or heart rate variability? And how would you go about improving HRV?
Oh, that was a lot of questions in one question. No, it's okay. So first and foremost, tracking and analyzing sleep in an athletic population is not straightforward, right? So there are a variety of questionnaires that would have been validated to an athletic population. I disregard them with a smile, because when I work with athletes, they're also people, meaning that they're actually also part of the general population. And if I only screened them with a questionnaire that was aiming for their athletic side, I would miss out quite a lot of information needed to understand what's going on outside of the training ground. So I've used the past 5-6 years to basically refine and create my own screening tool that embeds a lot of different validated questionnaires. And what I then always do, and I don't work with any player without conducting a screening. So I create a baseline to understand. I mean, if you were a football player, you might have scenario A as your problem. And if I was a football player, my scenario might have been different. I might have small children, you don't. So my sleeping problem is not only my scenario, but also the family setting that I'm in. So I'm kind of creating this big puzzle around my athletes to understand where the challenges would be, and also embedding things which would be internal from the environment, but also external from the private side. And then once I've conducted the screening, I always group them in a traffic light, quite simple: red, yellow, or green profile. And when it's an athlete in your green profile, you might actually have a lot of good rhythms and a lot of nice sleep output. But by doing certain things, we can gain the margins, which are quite important in football, because we're talking about a performance environment. If you're a red profile, you will for sure have problems like very short sleep duration, many awakenings, problems falling asleep, nights where you never fall asleep at all, and so forth. And then you need to start with a different baseline in order to implement the strategy.
Could I tune in on the red profile?
Yes, you can.
So somebody who has difficulty falling asleep, or somebody who is after having 4 hours sleep and then they wake up, And that's what I find can be more challenging, because you're after having 4 hours sleep and you're not quite exhausted enough to fall back asleep, but you're not quite awake enough to get up.
Yeah.
And then anxiety kicks in because, you know, you have to get up at 7 o'clock in the morning.
Yeah.
So what are the factors that you see are causing that? And would you put out any techniques in terms of what?
I mean, I'm talking to the masters of breathing techniques here. So for sure, breathing techniques can support in a situation like that. Breathing techniques can solve the problem or allude to a salvation of the problem. But quite often what I see is that it's the emotional side kicking in, so that when you do wake up, caused by XYZ factors, and when it comes to athletes, there are quite a lot of factors that can cause the awakening. Bad sleep hygiene is a major factor.
This is looking into their mobile phone, for example.
I would also say like the inability to have a consistent thermoregulation, because a lot of them, they sweat a lot at night. And because they sweat a lot of night and they might be wearing the wrong sleep garment, they will start to physically toss and turn throughout the night. And the first couple of times when you do it, it's okay, but the body will have a response. You're not awake, but the body will respond to it. The more you toss and turn, the more you will break your own sleep cycle. And every time you break your sleep cycle, you actually lower the quality of the sleep output. And you reduce, as an example, the time spent in deep sleep, where you produce this testosterone, you produce the growth hormone, which is then actually rebuilding your muscle and preventing you from creating muscle injuries. So if it's a very connected process, right? So there might be different factors to why you wake up. The important factor is that you then have tools in hand to resolve the challenge if you actually do wake up. But what I tend to work with is kind of like the bigger picture. So before falling asleep, what can we do to support you to actually have uninterrupted sleep? And breathing techniques are very supportive, but breathing techniques alone, if you're, as an example, an athlete who is not hydrating yourself in a sufficient way, then the breathing technique will not have the same effect, because you might be an athlete that puts too little attention on your hydration. And then at night before you go to bed, you're like, oh shit, I didn't drink enough. So I overhydrate. I go to bed and I don't have a sleeping disorder. I simply need to go to the toilet 10 times during the night because I was hydrating myself. And then, I was awake, and then I started to think about the game tomorrow, and that's again where the breathing technique can be extremely useful to get the anxiety level down. But again, the intervention is not only the breathing technique, it's also the hydration, if that makes sense.
Yeah, so you kind of like you have certain gateways. So if it's this problem, you do this, and if it's maybe anxiety, maybe then breathing is a good tool. But if it is hydration, you have something else, and the third or fourth or whatever it is. So you kind of work both before and during sleep.
Yeah, and to be fair, and you will like to hear this, I think, is 9 out of 10 times breathing techniques it's a massive tool, because when you work with athletes at a high level, they're extremely fit. They don't have actual sleeping disorders. They have bad sleep hygiene. They have anxiety problems. They have the problem of having a lot of pressure from an environment without actual techniques on how to remove that pressure and so forth. So the technique embedded needs to regard what the challenges are causing the sleeping problem, but you also need to regard who you're actually working with. So and I don't need to tell you guys, but if you meet, a really macho something player who never in his life tried yoga or meditation or anything, it needs to be embedded in a wise way, because it can strike them to be far from their normal mindset.
Yeah, I agree with that. I'm writing a book on focus and attention and concentration, and the word yoga will not be in it, and the word meditation will not be in it. And it's not that neither yoga or meditation are both excellent, but I think people of that caliber, they get confused or misinterpreted, and sometimes it can put them off.
Yeah, and I do a little bit the same, because I work very much with the methodology around active and passive choice making. Right? So we make a tremendous amount of choices throughout the day. You need to choose to drink in the correct way. Right? You need to passively not choose to forget to drink. So instead of wording it as me whacking a finger about not doing something, then they actively need to decide on doing something that ultimately will result in a good night's sleep. And they need to understand as well that just as much as they invest in performance, they actually need to invest in the other side, because that's the precondition of performance optimization.
It's our lifestyle every day. We say it about breathing as well, because how you breathe during wakefulness influences how you breathe during sleep.
Yeah, but I completely agree. Yeah. And I think we're very much aligned in the mindset around that.
And also the other thing is in terms of the respiratory physiology. So say, for example, if you have an athlete who is predisposed to a little bit more anxiety than others, they're more prone to breathing pattern disorders, and they're more prone to breathing faster and upper chest breathing. And the faster and upper chest breathing can also arouse us from sleep, because the body is interpreting it that we're not in a safe environment and takes us out of that deep sleep. So I like the way your screening tool, that you're looking at a multitude of different factors, and I totally agree with you. The Epworth sleep scale, for example, which is often used for the diagnosis of sleep apnea, is not very. It's an indicator. But I remember someone very close to me going into their hospital, and this person definitely has sleep apnea. He'd have a few glasses of wine at night, and he'd be in the sitting room and stopping breathing and resuming breathing with large gaps of air, etc. So off he goes down to the local hospital, and the nurse presents him with the Epworth sleep scale. Do you fall asleep at the wheel? No. Do you fall asleep watching television? No.
Yeah.
Presented him. Off you go. You're fine. Off you go.
Yeah.
Guide sleep apnea fell through the cracks. Validated questionnaires don't necessarily do it. And the same with breathing, the I'm-making questionnaires. So
yeah, but I think that's where we might, all of us, sit in this intersection of actually trying to translate some of this research into practice, and that's what I see myself as a little bit sometimes, the messenger, at least.
Yes,
the messenger that knows the outcome of a lot of the research project. It's quite interesting, because if you look at recent, maybe not the last years of research, but prior to that research in the athletic field in sleep, Pittsburgh, Epworth, and so forth were predominantly used to screen the athletes. And it eliminates a lot of interesting and valuable data to conclude anything. So we can use the questionnaires for a lot of things, but we can't use them to determine the actual strategy that needs to be embedded. What we can use is, what I always do when I work, as an example, with a football squad, is that I would look at overall things in the squad, like how many hours of sleep on a general basis does this squad actually get, because we know that there's a strong link between hours of sleep and the development of muscle injuries over a 24-month time span.
And
so
Anna,
oh,
sorry there to cut across you. So the hours of sleep and muscle growth,
yeah,
does that take into consideration the quality of sleep, the depth of sleep?
Not in this particular study, and it's a very, very fair question, and one that I always work with quite strongly, because I don't work with sleep hours as an isolated success factor, because you can have athletes laying in bed for 9 hours with a really, really poor sleep quality.
Yeah, that was me for 20 years. That was me. And I'd wake up exhausted, and I found the more I slept, the worse I was.
Yeah. And there are a lot of factors leaning towards as well being an oversleeper. You see it quite predominantly when we talk about napping, as an example. A nap is extremely beneficial, especially from a cognitive perspective, done in the right way. But a long nap, if you already have problems falling asleep at night and with no regard to your circadian rhythm, is actually hindering you from adding to your performance outcome. Because let's say you're an athlete, and I can say maybe in 20-25% of the cases when I work with athletes, they're over napping. They come back home from a training session, they would take a long nap in the afternoon. This pushes the sleep pressure back, so it's difficult for them to fall asleep at night. Then because they can't fall asleep, they'll start to get anxious because they know sleep is important. And then they're counting sheep. The sleep quality goes down, the amount of sleep hours goes down as well. So it's a very vicious circle. And the outcome, the cognitive beneficial outcome of a nap, a little bit like running the quick program on a dishwasher, right, for your brain. You don't really get that. And the good question that I'm always asking my athletes is that, do you nap? And they would say yes. And then I ask them, how do you feel when you wake up, alert or groggy? And in 60% of the cases, they will feel groggy when they wake up. But if you learn how to do a proper power nap, you will not be groggy when you wake up from the power nap. You'll be refreshed. And if you're waking up feeling groggy, it's more likely that you actually already descended into the deeper sleep phases that the body shouldn't really go into during the day at that point of time.
What's a long nap? Is it over 20 minutes or does it depend?
Everybody would love me to say like a very specific time. I usually say try to keep it below 30 minutes. But then in all fairness, if you were my athlete and I started working with you at a time where you would usually do a 2-hour nap per day, he would not be successful and I would not create success for him if we cut it down to 20 minutes straight away. I'm much more into cutting down slowly so that the body starts to adapt and from a cognitive perspective as well, mental perspective, that you accept that now it's going to be a different way.
It's amazing.
And I do that in basically every corner of my work with sleep. I don't preach. And I don't strive for optimal sleep, but I strive to optimize. And if people would be a red profile, as I said before, it needs to be done in a very strategic way in order to move them. Because if I came in and I did like research says that athlete would, in all fairness, that they would really benefit from around 9 hours of sleep. But if your average sleep hour is at the moment 6 and the quality is low, we need to kind of send benchmarks along the way that create success for them to maintain the pattern that they're working with. And I suppose it would be the same with breathing exercises. The more you practice, the more you get it into place, the more successful the outcome will be.
Yeah.
How do you, Anna, it's interesting because that leads me to that question with testing, like subjective and objective. Working with top athletes, they want to see results, they want to see progression, they want to obviously feel better.
Yeah.
But if you can see something, get validated, and if you then get anxious, it's kind of like a double-edged sword. You want to see progression, you want to measure stuff to see that you're kind of on the right track. And I know there's a difference between probably if you're in a green zone and yellow zone and red zone. But how do you deal with that paradox that you need to progress, but at the same time it can cause more stress testing everything?
I deal with it quite individually. And that's where you can call my method not super effective and why it takes time, because whenever you implement a method, you need to see a reaction among the person that you're actually working with. And again, a one-size-fits-all optimization model is going to create a little impact, but an individualized model where you actually really work with the person that you're working with respect to that person's psychological profile as well, that will move mountains. So a good example, you asked both of you now about objective technology, so I might have to touch upon that subject. So if you ask the technology companies, and I'm a little bit colored in the sense that I used to work on the other side with technology. I'm a strong believer in objective technology, but embedded and used in the right way. So you don't just hand out objective technology if you also do not hand out a tool. Because let's say you have an athlete and he will see that his sleep is extremely poor. By showing him the data, you don't resolve the problem, right? So if I use technology, I actually prefer to implement technology not straight away, but after a little while, so that I have an understanding of the response in the person that I'm working with. I also like to work with technology where I'm able to actually blind the data sometimes so that I can see the data, but the athlete doesn't necessarily see the data. especially in competition periods and so forth. And sometimes it's extremely good that they actually see the data, even though it's shitty data, and they can feel that, okay, even though I'm really in a poor place, I can still go out and perform. And what I use from a data perspective to make that quite clear is that the more the athlete will have a positive outcome of sleep on an overall basis, the better they will also feel that the body will tolerate the one-offs that they for sure will have. An athlete will never have a sleeping pattern that is just spot on to research recommendations. And they won't, because they're traveling, they have congested scheduling and so forth. So we kind of need to teach them that the one-offs are going to be there, but your body will deal so much better with it if the majority of what you're doing is actually being done consistently.
So yeah, I agree. But it's a tricky landscape, because you want to, how you should know which one you should measure and show the data for and so on, because I think athletes and even normal people, at least starting off, they want to see improvements. So how do you deal with the fact that you say 4 months, that it's this long-term, short-term kind of clash sometimes? I mean, people want to see at some point like some sort of result, but at the end, anything you become really good at takes a lot of time. Yeah. So I guess you have to work in both time dimensions.
Well, I do, but because I'm quite fortunate and I get to work one-on-one with my athletes, I also do a lot of qualitative analysis, in the sense that the conversation around where they feel the subjective difference is also a success criteria. So do you feel like your mood is better? Do you feel like you're more motivated? Do you feel, it's not only what we can measure from a very scientific, I'm extremely data driven. And at the same time, I'm extremely driven by the subjective qualitative outcome. How do you feel? So we started at point A. Now we're at point B. Ultimately, we will be at point C. Where did we move from? What didn't we move? And what do you want to move? If we are at point B now, what has become better and what do you still want to change? And then I use their own goal setting quite a lot as the carrot as well. So if you plan to become the next top player in the Premier League and you continue to do this, the risk is that you do, and then over time we can define some goals which might not be super sleep related, but it creates a motivation to why they have to stick to their routines.
So would you say that first, in general, well-being comes first and then performance on the field comes later on? I mean, you can have it the other way, but to some extent it makes sense to have well-being and balance first, because without that it's tough to have sustainable high performance in the long run. So, or is it individual based what you focus on?
I focus on it all, because I work with an athlete who's an athlete 24 hours a day. So usually I actually was smiling when you introduced me, because you called me a sleep expert. And it's quite interesting, because when I get that kind of stuck in my forehead, people's belief would be that my interest area would be everything that happens during the night for that athlete. My least interest, in all fairness, is what happens at night. It's everything that athlete would do during the day that leads to a sleep outcome. So my work with the athlete is not sleep. It's just as much well-being and everything that can be implemented, going back to breathing exercises and so forth, throughout the day, leading to optimized sleep at night. So I can't say that I'm working with them in the performance environment or outside, because I'm working with them on both arenas.
Yeah. Does it matter? Like I know that distractions in general is bad at night. Like it could be anything from TV to cell phones to even get agitated. That do you work during the day with certain things that you can do that if they're not as good, it's better to do them early in the day than the 2 or 3 hours before sleep? Do you have anything? It's not just, it's timing also when you do certain things.
But that goes a little bit back to the profile, right? So if you're a quite resilient profile, there are certain things that will just slide off, like Teflon, right?
Mm.
But if you are a very emotional profile and certain things require a lot of your emotional capacity, I would also suggest sometimes that we move a few things around. So sometimes there are things that we need to do that are super emotional and we just need to get them over with. But sometimes it is worth then doing it at other times of the day. But what I also work quite a lot with is something completely different. And that's the aspect of lowering arousal levels, not only because you have to go to sleep, but having micro breaks during the day that allows you to have the lower arousal level throughout the day, so that when you get to the nighttime, that your whole system is not just like buzzing off. Because that's the difficulty for a lot of athletes. They're just like this engine running around, like everything is just fast paced. And there's so much more today than athletes, right? They're athletes on the field, and then they're commercial people outside of the field, and their train is just like running 24/7. And that's a very, very high arousal level all the time. So embedding techniques that allow them to have micro breaks throughout the day, and it's literally micro breaks sometimes where they shut off completely, or just mindfulness exercises that can allow them to just like really turn their system off shortly. That can have a quite high impact on sleep as well.
And I think it's for everybody, Anna, because
I agree.
in terms of stimulating the vagus nerve and resetting, all it takes is 90 seconds. And I suppose people often feel that I don't have the time to do a reset, but I would totally agree with what you're saying. And just even that slow and prolonged exhalation.
Yeah, but I'm completely agree. I usually say, and that's again where it's quite interesting sometimes to work in a variety of sports. So in handball, you would have a short timeout. And I always ask my football players, why do you think we have a timeout in handball? And they're like, what do you mean? But we have the timeout because it allows the coach and you as a player to refocus and make sure that you're on the right track from the strategy that you wanted to implement. Taking a timeout and using the sports term timeout in other sports throughout the day, even though it's non-sports related, just making sure that, hey, what I'm doing now is actually, I'm on track, and you can completely use that in the corporate sector as well.
Yeah, I agree that it needs to be for everybody. So if you have a team, Anna, of 20 players that you're working with, would you say that they all have a tailored schedule? But could you say something, is there anything that they would have in common if they're in the green zone or red zone or yellow zone, that kind of like, I'm assuming if you're in the red zone, like arousal levels and so on, but is there any kind of somewhat general guidelines that you work with, or is it very highly tailored to each individual?
No, there are of course some guidelines that would apply for everyone, and that would go maybe more towards some of the quite low practical things in terms of not eating too late, hydration, as I talked about earlier on, the emotional capacity to actually shut down. That goes to whether you're a red profile or a green profile. Sleep hygiene. Everybody would benefit from sleeping in a cool sleeping environment, no matter if you're a green profile or a red profile. Making sure that what you do in the hours before going to bed can be extremely different, but everybody benefits from a low pace. And everybody benefits as well from a reduced light exposure. Everybody benefits from a big light exposure in the morning, because that supports your circadian rhythm. So that there are, and we talked about this just before we started the recording, there are a lot of general recommendations when it comes to sleep. And I completely agree with a lot of them. But in order to create true success when it comes to sleep, a lot of things need to be applied quite individually.
How do you, if you have somebody who's, I guess it doesn't matter if they're in the red zone or green zone or yellow zone, but say somebody who's in the yellow zone and they feel better, everything is pointing that they're moving into the green zone. So that's like a a little success story for that person and you. But how often does that translate into a subjective or objective increase in performance on the field? So that you have kind of have two, you can have one without the other, so to speak, or both.
I would say it's actually difficult to kind of directly estimate it like that, right? Because what I tend to do is that I correlate a lot of my data to epidemiology data, which is quite measurable. So if I'm working in a squad from we started until the end of the program, or if I work with them on a seasonal basis, I would look into sick days, player availability days, injuries, and so forth, because that's performance determining outcomes, right, on an overall level. And without putting myself on a pedestal, because it's awful to put it like that, and I'm not the one doing the job, remember that's actually the athletes working towards their own goals. And ultimately, when they do that, you see a quite big result on a squad level as well if you're working in team sports. But what I do see is that quite a lot of these epidemiology data, they turn positive. So we have more available players, we have a reduction in injuries and so forth. And that's the measurable scale that also proves the business case of sleep, if that makes sense.
Yeah, because I'm assuming it's not always one-to-one measurable, but it makes sense if somebody improves, everything increases, that their performance will be better. But there's so many other things that come into play that it's difficult to say.
And that's where it would be, I mean, that's actually where the technology sometimes comes in handy, because you can also then demonstrate that when you started at point A, the average hours of sleep that the squad got was this, and then over time we can demonstrate that the hours got up. We talked a little bit about HRV data and so forth. If we have some quite clear data points where we can see a positive change, it's caused by the intervention, but not only the intervention done by me, but the intervention done by the athlete himself, or in a squad setting, because the environment has a buy-in to what you're doing, right? So in an environment, let's say that I'm working quite heavily with sleep, but if the medical side does not support it and they just prescribe sleep medication, I have a little bit of a challenge, right? Then it's not really a success story on my end. So the success on the team level is actually that you create this multidisciplinary buy-in to sleep, because it sounds as if I'm putting sleep on a pedestal, but sleep is the foundation of success in all the domains around an athlete. And a good example is you have an athlete who needs to lose fat mass. And if he's not sleeping well and you have a nutritional intervention, he will overproduce the hormone that makes him hungry and underproduce the hormone that makes him feel full. So without a sleep intervention following a nutritional intervention, the successful outcome will not be the same.
How do you, Anna, then, there's so many things with sleep. I'm assuming you could work permanently with somebody. It's not like after 4 months, you're kind of good to go, or 1 year, but it's a continuous, even though, because sleep patterns maybe change over time, things change. So there's always something to do with a team. It's not like after a year, you can say, okay, now you're on your own. How does that work?
But that depends a little bit on who I'm working with and what the framework would be in the club that I'm working with. So quite often I work with the players for a certain period of time, and dependent on their outcome, I move them, and then I call them maintenance players.
Okay.
And then they can have access to me. Look, in all fairness, I would do a pretty poor job if their success would be dependent on me holding their hand all of the time. Right? So my success is when I'm actually making them independent of my, support. But that doesn't mean that it's not beneficial once in a while to just check in and just get a nudge or have a question, because, now my life changed. I'm becoming a father or something like that. Do you have any suggestions about what we can do? And I do that with the majority of the clients that I work with.
Yeah. Anna, have you ever seen any instance of mouth breathing during elite athletes? This is something that it affects about 50% of the adult population. It is something that affects us more as we're older. Once we're over 40 years of age, we're 6 times more likely to breathe through an open mouth during sleep.
Yeah.
And as I pointed earlier on, I was a chronic mouth breather because of stuffy nose.
Yeah.
And hay fever and rhinitis is going to impact the athletic population.
Yeah.
And we know that those individuals with rhinitis have 2 to 3 times a greater risk of sleep disorder breathing. Has it ever been looked at whether an athlete is breathing through their nose or through their mouth during sleep?
It's to be fair, again, I'm not in the bedroom when I don't have them in a sleep clinic facility because they are not sleep diagnostic needed athletes, if that makes sense. I'm absolutely sure, and especially when you refer to the statistics that you refer to, that they will be among my clients as well. Maybe from an age perspective, because if you look at footballers, in all fairness, and their peak age wouldn't be towards the 40s, right? It would be younger athletes. But for sure they will be there.
I think it would be very interesting to and
it's a very fair point.
How many of them are waking up with a dry mouth in the morning, and also those that have had to get orthodontic treatment, because there's one aspect about orthodontic treatment is when we have overcrowding of teeth, it can point to the fact that our jaws are very narrow. And as a result, then there's less room for the tongue. And if there's less room for the tongue in the mouth, the tongue is more likely to encroach on the airway. So even though the athlete may not have sleep apnea or hypopnea, but they might have upper airway resistance syndrome. And sometimes that can feed into us waking up as well after 3 or 4 hours sleep. And I would totally agree with you that sleep is the foundation of focus and concentration. And when I hear about what you talked about, that if sleep quality isn't good, players are more likely to be injured, could that just be that they're more kind of a little bit careless because they're not able to focus on their game? Could that also play a role with it?
That would definitely play a role as well. I mean, I usually try to link it back to the aspect of what we call sleepy driving, right? We know that every 30 seconds there's a road accident somewhere in the world caused by what we would call a sleepy driver. And when you are a sleepy driver, you're not abusing alcohol. You're simply just sleep deprived, but your reaction pattern would be the same as if you were driving around with the alcohol in your blood. We have sleep deprived athletes for sure. The statistics, I didn't invent them, but they're quite clear. And again, try to correlate the two aspects. A sleepy driver causing accidents because he's not reacting quick enough. He's not making the right decision making and so forth. Yes, I think we do see injuries because, and that would be maybe more like the direct contact injuries and not the tear and wear injuries, because we have athletes who are sleep deprived making the wrong decision to run right instead of left, as an example on the field.
Could I bring in?
Yes, sorry.
Oh, sorry, I apologize. Sorry about this. I have a habit of cutting across you. Concussion is something that we're hearing more and more of. And there has been one expert, I think it was Dr. Cobb, come out doing breath holding to help increase blood flow to the brain post-concussion. But normally when a player is concussed, there's not really a whole lot that's done about it in terms of helping to improve blood flow to the brain. But during the period post-concussion, that blood flow to the brain can be reduced. Would concussion impact sleep, do you think?
I've had a few, I've not had many, I have to say that honestly, but I've had a few concussed players, and what I quite often see is an interesting thing. This is not published data or I see a delay in the sleeping problem.
Okay.
Which is quite interesting. So it's usually a certain time after the concussion has actually taken place that they start to have the sleeping problems.
Wow.
And what are we talking about, a month after or a year after, roughly?
A couple of months.
Yeah.
Roughly.
Yeah.
And again, I don't have like the statistical data on it, and maybe because my amount of players with concussions wouldn't really create a significant, display material, but I see it on a common, it would be a couple of months after.
Yeah. In the next 18 months is a pretty unprecedented schedule for football players.
Yeah.
And I saw something about traveling and how that impacts sleep. So you have in the high, if you're in Premier League or in Champions League, you travel a lot. Even, but if you're only in Premier League, you travel domestically. But then you have European Cup, so you have training, and those people who are in the national teams have probably traveled to one place, and now this summer they're going to travel all over the place in the fall, and then they got World Cup next year. So the amount of matches, the amount of traveling will be probably unprecedented in the next 18 months. So how do you deal with somebody who travels a lot? Because I've said, I mean, you kind of shifted the daily rhythm and time zones and everything. You can't even sleep when you want to necessarily. So late matches, and so you know that the schedule is going to be different. How do you deal when you know you're going to kind of have issues or problems?
In all fairness, everything that you say there is exactly why you can't translate, sleep science into practice, because that works against everything we know about sleep physiology. So I would highly work with athletes' ability to snap out whenever they have the opportunity to do it. I would work very much with them on scheduling when they nap, when they sleep, and so forth. And then on a more like strategic level, I work with the team logistics about how do we make sure that if this is the framework, do we sometimes stay over and then let them sleep, as an example. In terms of airlines, what are they flying with and what do they actually serve on the plane? Because if you're traveling towards a time zone or away from a time zone, the even things like when they serve coffee, tea, the caffeine can have an impact in terms of how they manipulate their circadian rhythm. If it's a long haul travel, it's one situation. Hydration plays a role no matter where you travel, because again, dehydration leads to sleeping problems. But it would depend very much about how long, where, across which time zones, east, west. And another factor would be looking at not only logistics while traveling, but also logistics upon arrival and arriving back home. And then that goes a little bit back to the profiles, because if you've had a profile who's completely exhausted from traveling, sometimes the investment of letting that player sleep a night in a hotel, an extra night in a hotel, pays off. But if that player has a family at home, let's say a football player, and his wife is really angry because now she's been at home for 3 days with a small baby, his anxiety is going to be extremely high because he feels guilty sleeping in that hotel. And that's why it needs to be applied case by case and very individually as well.
Because
I realized to get a more understanding wife.
Yeah, that's like the next level.
You work with that as well. Yeah, but like you said, Anna, with just like if you're hot at night, so it will be a different maybe not necessarily schedule, but if you the way you sleep in the wintertime versus now if you play in a hot zone during the summer, because your hydration and you can't even, and it's hot at night, and most people and most hotels have AC, but still all these things and traveling will shift. So I understand it's not a one size fits all as well. It's difficult because you have to take in all these things into consideration.
I mean, it would be super nice if I could just like roll out this recipe and tell you that this, if you follow the bullet points here, you're full safe. But you can't do that. But you can apply things that will work independent of scenario. And that goes back to Patrick's question before about, are there things that goes across, the 3 profile types that I'm working with? Yes, there is. Are there things that will work independent of travel congested schedule? Yes, there is, but it still needs to be applied with respect to who you're actually working with. A good example, now you talked about mouth breathing. We didn't even talk about snoring or being sound sensitive, but let's say you have a profile who's extremely sound sensitive, and from a social perspective, you would bulk him in a room with a snoring football player. He will not close an eye during the night. right? So things like that needs to come into consideration. That might not be a problem at Premier League level because you will have the finances to just, you know, book single rooms. But in other leagues, that might not be the case because you can't afford to give every player a single room.
In the military as well, Anna.
Yes,
you know,
but I used to work
deployment.
in the military as well. So I'm completely with you. Yeah.
How do you, but now you're talking about the players, do you incorporate coaching, I mean coaches and staff as well, to kind of like everybody's, so they know, have the same, so you don't have, you telling the players and the coaches don't care because they have their own schedule. So are you working with coaches as well?
I work with the coaches as well, but I always have a completely sealed relationship with my athlete, and a completely strictly confidential relationship with my athletes. I don't report back to the management. I might come across, I quite often come across things where I would ask the athlete if she would be comfortable with me sharing that in the environment. If they're not, what I will do sometimes, not going back to personal data, but highlight that there might be some things that would be good to address in the environment, but on an overall anonymized basis. And that sealed relationship is a big key to why you can create, I wouldn't say success, but why you can create a change, because trust is a massive thing. And again, trust is needed because sleep is very vulnerable. There are a million reasons to why we can't sleep, and quite often they're very vulnerable. And sometimes I think I might have an advantage, to be fair, with the tag you put on my forehead, because it's not so scary maybe to talk to a sleep specialist, because I don't have psychiatrist or psychologist in my forehead. But the first place that the challenge will present itself, without sometimes the athlete or the player knowing it, is because they can't fall asleep, right? That's the measurable impact of an emotional instability.
I have actually one thing that I forgot to ask you is there a difference? Have you noticed a difference between men and females? Because female breathing is different during phases during a month. So in that aspect, it wouldn't be surprising that females, sleep will be different as well.
There are differences, and there are also physiological differences. You don't have a menopause, we do. And the menopause plays a role also.
Huge role.
In the aspect of thermoregulation and so forth. So there are, and do I see a difference in the application and the way that you can apply it? Sometimes, yes, there will be a gender difference, but women are just as different as male football players, right? So that would go a little bit back to the profile as well.
It's funny with breathing, Anna, and it's something I've only started looking at in the last 6 months, even though at least 60% of my clients were female over the years. That in the monthly cycle, so post-ovulation, between days 10 and days 22, there's an increase in progesterone and estrogen, which is a respiratory stimulant. So breathing becomes faster and may be more likely to be upper chest breathing. But that will drive up anxiety, but that will also interrupt sleep patterns. And the performance of a female during the monthly cycle is going to be affected by hormonal changes that are impacting breathing. So the symptoms of PMS can be very much attributed to hyperventilation as a result of hormonal changes. And the other aspect of which has received very little research is postmenopause. You spoke about thermoregulation. When sleep disorder breathing, that progesterone and estrogen seems to protect females against sleep disorder breathing. And it causes a stiffening, or that the upper airway doesn't collapse so easy. But post-menopause, when hormones level off, sleep disorder breathing can increase by 300%. So 27% of females aged between 50 and 70 years of age are prone to sleep disorder breathing. But we've seen it when we get changing breathing patterns, that hot sweats and hot flashes are reducing. But again, it hasn't been studied, which is the problem. So we're only seeing it anecdotally.
And if you look again at at sleep studies done on female athletes, it's also a very limited sample size quite often. So I can talk more about what I see in real life than I can refer to research, in all fairness. We know, a thing that we know is that pain perception is affected by sleep, right?
Yes.
So the less we sleep, the higher our pain perception will be, to put it quite simple. But I always, again, talk about that mental side of that individual profile, because your pain perception might be different to my pain perception as well. And then there might be a gender difference between how we perceive pain and so forth. Going back to sleep, sometimes what I see is that especially when I screen the athletes, is that more women tend to have pain going to bed than male athletes would have. And then you have the period of the month where they would have like the menopause and so forth. And quite often the menopause is causing that they have a feeling of a higher pain, which is, again, is quite unscientific, but is purely based on what I experience among the female athletes. But it's a little bit interesting, going back to what you say about the breathing, because
definitely, because
it sounds like there might be a link, an unstudied link.
Increased pain is going to impact sleep. I see a triangle between breathing, the emotions, and sleep.
Yeah.
And if we have a racing mind, we're not going to fall asleep so well. But if we don't get that deep sleep quality, we're going to have a racing mind.
Yeah.
But if we have poor breathing patterns, that's going to impact the racing mind. But poor breathing patterns will also change our sleep. You spoke about snoring, and I often use the example of, and I'm just conscious of time, so we'll be wrapping up just of your time too, but mouth snoring. So I often say to our students, try and snore through your mouth, and they go like this. And now get your mouth closed and try and snore through your mouth. And you can't. And then snore through your nose, and it goes like this. But now breathe really slowly and take a very soft breath in through your nose and a relaxed and slow, gentle breath out. And as you're breathing slowly, try and snore through your nose, and you'll see it's more difficult.
Yeah.
That resistance to breathing is not just solely down to anatomical issues, but it's also due to flow rates.
Yeah. Yeah.
That we have to think of the upper airway as a pipe. And if an engineer was approaching a pipe, the engineer would look at the diameter of the pipe, but would also look at the flow that's going through the pipe. But in terms of sleep medicine, the only attention seems to have been put on the pipe itself, but not necessarily on the flow. And I think that's where we need to have a little bit more investigation and debate and research into it. So, but these are all bi-directional relationships. I don't think anybody can have a stability of the mind unless they have good sleep and good breathing. And you know, it's really amazing.
I don't think that people can have stability of their mind, because the world that they're trying to stable it in is quite unstable.
That's
right?
true as well.
So a lot of the things that would surround the athlete, and this kind of hammers down your concept and my concept a little bit as well, said with a smile, is that we can work on a variety of strategies, and then things are suddenly coming out of the blue, whether it's in an athletic setting or in a normal daily life setting for you and me. What we can do is that we can provide and practice and try to prevent with strategies on many levels, so that they can combat it. And again, I agree that a lot of the things related to the racing mind would be related back to sleep, but it also goes back to your capacity of emotional resilience, which goes back to many things, like how were you brought up and the whole psychological aspect of who you are as a profile. Because again, what might raise in your mind might not affect me, vice versa. So to be successful, it needs to be this very holistic approach where we can draw benefits from different ways of working. Especially, I really strongly believe in breathing techniques, especially in combination, and especially with respect to who you're actually working with.
That's great. I mean, I think I got answers on all my questions here, and every question is really a topic of its own that we could really delve into. So, and also there are other sports than football, but so this was great, and it was only like a tip of the iceberg where you can kind of go into, but to kind of get in, not too deep into every typical question or every question. So I am all done. It was great, really fascinating answer. So any more from you, Patrick?
No, I very much enjoyed it. Thanks very much, Anna. There was some great information and nuggets there.
Yeah.
And I think it's the complexity of the human being ultimately. And
I think that's a good wrap up.
Tailoring to that. So Anna West, thank you so much. It was a pleasure talking to you.
Thank you very much.